respected teachers and fellow colleagues. I am Dr. Promi Borua and my co-presenter Dr. Devendra Malpartho. Today we are going to present about dengue diagnosis and management. We can see a case here. A 21-year-old female came with a complaint of fever. Highest recorded temperature was 103 degree Fahrenheit, which is associated with headache, generous body ache, and retroorbital pain for 3 days. What is her diagnosis? Her diagnosis is dengue fever. So, what is the dengue infection? Dengue is a disease caused by an arbovirus. There are 4 serotypes: dengue 1, dengue 2, dengue 3, and dengue 4. It is regarded as most important arthropod transmitted human viral disease. The vector for arbovirus is Aedes aegypti, which is the primary vector, and the secondary vector is Aedes albopictus. Here we can see the dengue mortality rate in Bangladesh 2023. As we know, the dengue seasons in Bangladesh starts from June or July and ends in between October and November. In this year, the rising of affected case and fatality in June, whereas the decreases of numbers in July month. But we are still fighting with the dengue throughout the year. Dengue endemic throughout the year. Dengue can be presented as symptomatic or asymptomatic. Most few cases are asymptomatic and mostly are symptomatic. And it is classified as in unrefrigerated fever, dengue hemorrhagic fever, and expanded dengue syndrome. Dengue hemorrhagic fever can be complicated with plasma leakage and which leads to shock, and it is called dengue shock syndrome. In dengue fever, symptoms will be high-grade fever, headache, or retroorbital pain, and other symptoms are anorexia, or taste sensation, and constipation. In dengue hemorrhagic fever, the clinical process of illness passes through the following 3 phases: febrile phase, critical phase, and convalescent phase. Here we can see the natural course of dengue fever and dengue hemorrhagic fever. In dengue hemorrhagic fever, there will be 2 phases: febrile phase and convalescent phase. In febrile phase, high-grade fever will persist for 2 to 7 days, and there is no critical phase. In convalescent phase, 2 to 5 days longer in adults. In case of dengue hemorrhagic fever, febrile phase and convalescent phase are same as dengue fever. There is critical phase also, which can start from day 3. In dengue shock syndrome, classical dengue fever will be present with significant loss of plasma, which leads to shock, and manifested by rapid quick pulse, narrow pulse pressure, hypotension, and cold clammy skin, restlessness, and undetectable blood pressure and pulse. In case of expanded dengue syndrome, unusual manifestations with severe organ involvement is present, such as liver, kidney, and heart and brain. Dengue can be presented with or without warning signs, and both can be progressed into severe dengue. So, what is the criteria for severe dengue? The criteria are severe plasma leakage, which leads to shock and fluid accumulation with respiratory distress. There can be also presence of severe bleeding, severe organ involvement. So, what are the criteria? So, who we can suspect that has dengue? A patient that traveled to dengue endemic area or has fever or has fever and 2 following following criteria: nausea, vomiting, rash, aches and pains, leukopenia. Probability test will be positive. Any warning signs and laboratory confirmed dengue. So, what are the warning signs? Warning signs should be observed in all type of dengue patients, and warning signs are abdominal pain or tenderness, persistent vomiting, mucosal bleeding, clinical accumulation of fluid, lethargy, restlessness, and liver enlargement more than 20 centimeter. In laboratory investigation, we will see increase in ACT concurrent with rapid decrease in platelet count. Two special tests are done in all dengue patients, especially in critical phase. In tourniquet test, that is a test for detecting covert hemorrhage. Considered positive if it is 10 or more than 10, and definitive positive it is 20 or more than 20. In case of capillary refilling type, that detects the volume status of the body. If it is more than 3 seconds, we suspect there is a gross hypovolemia. What is now in the next slide? You can see the evidence of plasma leakage. What are the evidence of plasma leakage? Hematocrit will be rises 20% from the baseline, and there will be signs of circulatory failure like cold clammy skin, tachycardia, quick pulse, narrow pulse pressure, and hypertension. Fluid accumulation will be present as acids and pleural effusion. And in laboratory investigation, we will see the serum albumin level is less than 3.5 gram per deciliter. So, we should suspect the dengue in a patient with comparable signs and symptoms, but we do some confirmations, do some investigations for confirmation. And those investigations are complete blood count, SGPT and SGOT, coagulation profile test, urinary chest X-ray and ultrasonography for differential diagnosis. So, what are the time of investigations? If the patient comes within 1 to 5 days of fever, CBC, NS1 antigen, and SGPT and SGOT should be done. If the patient comes 5 to 7 days of fever, we prefer not to do any investigation. And if the patient comes 7 days after fever, we do CBC, dengue, IgG, IgM, antibodies, SGPT, and SGOT. Here is a representation of kinetics of NS1 antigen, IgG, and IgM. We can see NS1 antigen is peaks at day 2, and whereas the IgM and IgG peaks at day 6. In complete blood count, we can see the hematocrit count is more than 20% from baseline. There will be leukopenia, there can be thrombocytopenia, and breast ESR due to dehydration. In case of SGOT and SGPT, both are elevated in dengue fever and dengue hemorrhagic fever, but SGOT is more in dengue hemorrhagic fever. And in coagulation profile test, coagulation factors are reduced in dengue shock syndrome, and APTT and PT are thorough in dengue hemorrhagic fever. So, the rest of the presentation will be present by